East FM. This is The Late Breakfast. I'm your host, Phil. Now, as promised, we've got a special guest in the studio from Crawford House. And as I mentioned earlier in the morning, this last month has been Diabetes Action Month. It's going to finish on the 30th, so we've still got 3 days. And we've got Stephanie Zhang to talk about it here with us. Good morning. Welcome along to the studios here at East FM.
Good morning. I'm Stephanie. Thank you so much to have me here today.
Oh, it's very good to have you here. And we've been doing these interviews for quite some time with Crawford, with the opening of the wellbeing and centre and all the rest of it. And full disclosure, I'm a Crawford medical patient, have been since I was a little wee kid. I think my mum and dad were one of the foundation patients, but that won't make any difference to our chat this morning. Let's talk about diabetes, because I'm sure people know that there are two types, there's type 1 and type 2. Type 1 being the more serious, would that be correct?
I would say actually not just type 1 and type 2. We got type 1 diabetes, type 2 diabetes, gestational diabetes for women who is pregnant, and also others because of medication can induce diabetes, or patients got pancreatic insufficiency. Those kind of things can also causing diabetes as well. So diabetes, we generally knows it's only type 1 and type 2, but actually it's not just type 1 diabetes and type 2 diabetes. And also there is not type 1 diabetes more serious because of we are looking for the control, diabetes control.
Yes.
Patients have type 2 diabetes can also having a very poor control, or type 1 diabetes, we do got patient has a very good diabetes control. So it's not which one will be worse. We're looking for the diabetes control. Yes.
And what are the symptoms?
So the symptoms usually they will present feeling for poor diabetes control patient, they will feeling they may be lost weight, or they will be go increased toileting, increased feeling thirsty, and those are the common symptoms, and they will feeling hungry most of the time.
And is it like a lot of other ailments that if you capture it early, you can conquer it?
I think we did so many study that I think you are talking about the remission type diabetes.
Yes.
Especially it's a very for don't know why after the patient having a bariatric surgery which is one of the weight loss management, and the patients will have the remission type 2 diabetes, but not type 1 diabetes at this stage. But as you know, the study is doing everywhere every day, so we may be next days type 1 diabetes will be remission. We don't know, but the key point is make sure you got a good control for diabetes and also prevent the diabetes complications.
And did I read somewhere that type 1 especially can be hereditary?
Type 1 patient with type 1 diabetes it's a bit tricky. Yes. Because patient with type 1 diabetes, be honest, they need to make at least 180 decisions per day. Yes, and also for to having a high blood sugar level is not just related to your eating. Actually, there's about at least 42 risk factor can causing high blood sugar level. For example, stress, medication, infection, illness, hormone can also causing high blood sugar level.
And if you're a type 1 diabetic, is that to get to the stage where you have to inject yourself? You have to.
Yes, so because type 1 diabetes, their pancreas no longer produce any insulin, or they just produce very small amount of insulin. That's why they need to be on insulin every day. So for insulin injection, usually type 1 diabetes may need to give themselves at least 4 or 5 times insulin injection per day. But now we got the diabetes technology insulin pump can help them to reduce the burden. They just need to change the infusion set to the insulin pump every 2 or 3 days.
There was something in the news about that yesterday. Pharmax thinking about funding a different a system that's used in Australia but isn't funded here. Is that the pump thing that you were talking about?
Actually, the Pharmac has been funding the insulin pump for long, but like since last year, like 1st of October, they have been like changed the criteria and make the criteria more simplified, which means like if you are having type 1 diabetes, the Pharmac will going to fund you the glucose continuous sensor, which helps you to monitor your blood sugar level.
Yes.
Another one is like the insulin pump. At the moment, they are funding 2 different insulin pump, and you need to be type 1 diabetes. Yeah.
And we'll get on to type 2 very shortly, but I've got a friend that's a type 1 diabetic, and he's constantly monitoring his blood sugar with a little prick on his finger and all the rest of it. Yeah. And he probably injects himself I think maybe 3 times a day.
Yeah. So like that's why the insulin pump will be help them to improve the diabetes control. But I would say that like the insulin pump is not a magic bullet, because like they involve so many intensive education and training for that. Yeah, and also like at the moment, our insulin pump still have a closed loop, which means like when you're eating, you still need to tell the pump, I'm eating like yes, like about like the amount of carbohydrate, like how much you are eating. It doesn't have to be like exactly like correct amount, right? Like some people got a good estimation for carbohydrate counting, and some people got a low, like poor estimation. So the insulin pump can help you fill up the gaps. Like if you underestimate the carbohydrates, fine. The insulin pump will deliver more insulin to make sure you are in the target range. But if you are like overestimate the carbohydrate, like the insulin pump will reduce the insulin, will give you if you overestimate, then like it will give you a little bit more insulin.
Yes.
Yeah, to prevent the high blood sugar level and make sure you are on the tight target.
And it's a huge problem in New Zealand, isn't it? Because I went on the website and learned about the active month and everything. They said over 300,000 people have diabetes in New Zealand.
Yes, it's about like 348 more than 1,000 like New Zealanders has type diabetes. And you know how much people in counties Manukau is about close to 48,000, and the number is increasing, and also the population is getting more younger and younger. So like you will see like some teenager like about like 12
really
years old, they started to having type 2 diabetes.
And is that because of inactivity and diet and things like that? Is that factor?
Yes. Yeah. So like the environment and social media, yes, and also like the price for the food at the moment. Yeah.
Wow, that's a lot. And I suppose the answer's at your hands if it's you that's suffering, but a lot of people don't, do they? They just ignore it. They just keep doing what they're doing. They keep guzzling their Coca-Cola and eating their KFC and all of us. Look, again, full disclosure, I love Coca-Cola. I'm not a diabetic, but I love Coca-Cola.
Yeah, I would say like diabetes management is very tricky because like you need to find like 7 of 10 the population, they are working age, and then like they need to find time to check their blood sugar level, do the insulin, and make sure themselves like eating healthy and like the food options, exercise. There's lots of things to do, and also like the stigma and the misunderstanding, and we will make it more harder for the diabetes management. That's why the diabetes technology makes a huge difference. Like we use like in before, like we need to use a finger prick, like prick our finger to check the blood sugar level, and now we got we call sensor, continuous glucose sensor, to help you to monitor the blood sugar level, which is good, like help to reduce the burden. Yeah.
Wow, there's a lot to think about.
Yeah, so that's why in our like Crawford Wellness Center, like we provide annual diabetes assessment, food assessment, and also like we can provide like teach you how to use the diabetes technology and to help you to improve your diabetes control and well-being.
If you've got type 2 diabetes and you follow all the instructions, you get off the couch, you do some exercise, you lose some weight, you don't eat bad, can you reverse it? Or if you've got it, you've got it?
That's what, like, to be honest, like for diabetes, like we are not just looking for a number. Okay, in our Crawford Wellness Center, we provide a holistic care. Yes. So like we've got like, you know, like we've not just focusing on the medication, but also we're focusing on the non-pharmacotherapy as well. That's why like we got a kind of a multiple disciplinary team in our Crawford Wellness Center.
Yes.
So like we got Lauren, like do the exercise. For the exercise, we got Sean, the health psychologist.
You had Sean in here.
Yes,
I've had Lauren too, actually.
And also we got Sarah. She's the health coach for the diet advice. And also we got a new member joining as well. Like she is Melissa. She's the midwife and also do the acupuncture as well. So like for us, like we are not just focusing on the number, but we also like look after, like, you know, physical, emotional, spiritual, and also mental health as well.
I know, and I mentioned this to Sean when he was in here. Crawfords were one of the first to sort of adopt the green prescription.
Yeah.
And that's basically looking after yourself, getting out, going for a walk, you know, taking care of your body, looking at what you're putting in and getting out and all the rest of it. And yeah, like I say, they were one of the first to adopt that, certainly in this area.
Yeah, because in our like Crawford Wellness Center, we put our vision is like early detection and also early prevention. Okay, yeah, because diabetes can induce so many complications like obesity, like hypertension, renal disease, cardiovascular disease, yeah, and fatty liver. So, yeah, so.
And the type 1, that can lead to eye problems and lack of limbs, can't it? You can have feet amputated and things like that if it gets really, really bad.
Yes, so that's why, like, not just type 1 diabetes, like also for patient with diabetes as well.
Okay.
They need to have a regular retinal screen. So like the government is funded like to having the retinal screening like every 1 to 2 years to check the back of your eyes to see is there any damage to the nerve of your eyes or any bleeding. Yeah, because like our eyes vessel is very tiny and very tricky. It doesn't like to having a high blood sugar level or the blood sugar level like a yo-yo. So yeah, and also 50% of patient has the diabetes foot ulcer will end up to having amputation.
Wow.
Yes.
Wow.
So that's why in our Crawford Wellness Center, like our nurses will provide like the annual foot check to every patient for people with type 2 diabetes.
And I guess, I don't know, does that just start out like a sore and it just gets worse and infected and it gets worse and worse?
Yes, and also because of the poor diabetes control, it will delay the wound healing and also increase the risk to get the infection. So there may be another risk factor. That's why like increase the risk to get the amputation.
So if I'm feeling a bit unwell, and I've been feeling a bit unwell for quite some time, and I go up to the doctor and the doctor said, look, we're going to do a screen for, that's a blood test, isn't it?
Yes, the regular blood test. So like the regular blood test, we suggest like do it every 3 to 3 months. If you got a good control, maybe every 3 to 6 months. So like not just check your diabetes, but also check your kidney function, lipid test, liver function, thyroid function, and urine test as well. Because like the poor diabetes control can induce like hypertension, proteinuria, and also some kidney issue as well.
They say, don't they, that hypertension, which is high blood pressure for people not keeping up, it's a silent killer, isn't it?
Yes, it's silent killer. And also like as I say, like obesity is another common risk factor related to type poor diabetes control as well.
And the thing is, if you get out and exercise, and I'm a bit of it, well, I used to be a bit of an exercise zealot, but if you get out and exercise, not only are you going to reduce your weight, it seems to me it's a simple equation. If you burn more than you put in, you'll lose weight. That's just how it works, isn't it?
I think,
in a way, like you've got to put the fuel in,
yeah.
And then if you're exercising, you're going to burn the fuel. If you burn more than you put in, you're probably going to be either stable or you're certainly not going to be you're not going to be super overweight. But I don't know where I was going with this now.
But we also promote the healthy eating as well.
Yes,
That's
yes.
another key things like too. Yeah. So like you can't like just like having regular exercise, but at the same time you eat heaps of like junk food. Yeah. So like that's why we promote like lifestyle. Yeah, lifestyle modification is very important as well. Like you're building a house, like
Yes.
you need to have a good
foundation.
foundations,
Yes,
and then
yes.
the exercise, like regular exercise, healthy eating, weight control. That's your foundation to build. Like make sure you gonna, having a good control. Yeah.
And it doesn't have to be a lot, does it? It just has to be some.
Yes, yeah. So like if you haven't been doing any exercise, I would suggest like maybe 5 to 10 minutes every, like maybe 1 or 2 days every week, and then slowly increase
Build
your
up. Yeah.
duration and frequency. Yeah.
We were doing a thing yesterday on the show, and I was talking about running because my dad was a really good runner, and I used to do a fair bit of running. And he said that when you start out, you should run a lamppost, walk a lamppost, like a distance between 2 lampposts. Run a lamppost, walk a lamppost, run a lamppost, and then slowly build up.
Yes. And then after.
And as you mentioned, if you are going to start an exercise program and you haven't exercised for a long time, go and see your doctor
Yes.
before you start.
Yeah, because like when you seeing us, like we need to find out what causing, like, okay, every time when we see you, we will set up a goal to you, and then after you come back, we will have a lot. Is it achievable for the goal? It's no point that I set a very high goal for you, but it's not achievable, right? It's like we work together, not I tell you what to do. It's we work together, and then we set up the goal that you can achieve. And then if you can't achieve, it's okay. We
Modify the goal.
We just redo it again to find something like a suit to your lifestyle, and then the thing you can. You can able to.
I know when Sean was here and he was talking about mental health and well-being and things like that, he said you don't necessarily have to be a patient at Crawford's to use the welfare, the well-being centre.
Yeah, no.
Is that the same for you?
I think so. Yes. So you just need to go to the our website, or
Yes.
like you go call our reception, and then they can book you to see me. Yes.
And are you busy?
At the moment, kind of, because as you know, the diabetes number is increasing every year, especially our county. So yes.
And how important is it to get the message out? Because I mean, people that, well, I surmise, but people that are a little bit overweight and eating junk food and all the rest of it, they might not know that they're even a risk.
Yes, because like most of the time, like they don't think like obesity is a chronic disease, and also like obesity is also one of the metabolic syndrome, which is like can increase the risk to get a heart failure, cardiovascular disease, and diabetic kidney disease, or increase the risk to get the stroke, fatty liver. Yeah, so like I think like. For the message I would like to send out is like reduce the stigma and increase awareness of diabetes and also obesity. Yeah.
And it doesn't hurt to ask questions.
No, like because like we wanted to ask the patient like we need to. I know people is very sensitive when they talk about the obesity.
Yes.
But like we need to ask the patient like what makes you. Why you feel like how do you feel about obesity and overweight? Yes. So and then they will slowly to open up to you. Yeah.
But that could be a habitual thing as well, because if you've always overeaten, and I remember, there was the clean plate syndrome when we were little kids, and if you don't eat all your food, you won't get any dessert or something like that. So that compelled you to stuff the food of the dinner in, even though you didn't want to eat all of it anyway. So that probably was a building block for thinking, I've got to eat, and that progresses as you get older. You need to eat more.
Yeah, and also like related to the current socio-economic factors, the cost of living, and also like take price to the food supermarket and grocery, and also quick and easy take out like the food.
The convenience of it.
Yeah, and some people need to working a long hours, so like after they finish work they just feeling so tired and exhausted. So like those are the risk factor causing like just like trying a little bit how to choose limitation to having a good choice for like healthy choice for the food.
All right, just as we wrap up here, tell us how we can get in touch and how we can start our first steps of recovery if that's in fact what we're after.
So I think first of all, like back to the basic,
yes.
Good foundation, like healthy eating, exercise, and weight control. Yeah.
And if you're a patient at Crawford Medical, well, you can just go through them or look on the website, because the website's very good. And now with the wellbeing centre, I had a look at some of the photos. Wow, it's something special.
Yes, our Crawford Wellness Center is expanding at the moment, not just having a diabetes like specialist clinic, but also we are having the weight loss clinic as well. Yes.
All right. Well, thank you, Stephanie, for coming in and seeing us this morning. It's been entertaining and it's been enlightening. And folks, if you're worried, the first port of call, I guess, is your doctor, and after that, maybe you become a patient of Stephanie's.
Thank you so much.
Thank you. There is Stephanie Zhang from the Crawford Wellbeing Corporate Centre up there in Picton Street.